Let's delve into the process of cataract surgery, covering what you can expect before, during, and after the procedure. A cataract refers to the clouding of the lens inside your eye, a condition that naturally develops over time. Certain factors, like genetics, specific medications, or conditions such as diabetes, may predispose individuals to early cataract formation. Despite taking preventive measures, cataracts can still be influenced by external factors. Eventually, most of us will develop visually significant cataracts that require attention during our lifetime. The optimal timing for cataract surgery varies from person to person and hinges on individual visual needs. Generally, it's recommended to consider cataract surgery when your vision impedes your ability to perform desired or necessary tasks. At this point, it's advisable to seek a consultation with a cataract surgeon in your area. A cataract consultation differs slightly from a regular eye examination. Your healthcare provider will conduct a comprehensive eye exam, including assessing your vision with and without glasses. They will also perform tests to examine the shape of the cornea, the front part of the eye, and evaluate the health of the retina, the back part of the eye. These tests are crucial in discussing cataracts with you, ensuring there are no other eye conditions affecting your vision, and guiding your provider in selecting the most suitable lens for you. The initial test your provider will perform is called topography. This test examines the shape of your cornea to determine if you have astigmatism. Astigmatism occurs when the cornea is not perfectly spherical but instead resembles a football shape. You have significant astigmatism. Your provider may discuss the possibility of using a toric lens during cataract surgery to correct the astigmatism. Topography is also vital for assessing the health of your cornea. Keratoconus, a common corneal disease, often goes unnoticed, even in its early stages. Detecting keratoconus is important, as it may affect your eligibility for certain lens types or brands. Another significant test is an optical coherence tomography scan, which provides a detailed image of the layers at the back of the retina. This scan focuses on the macula, the central part of the retina. It helps identify subtle scar tissue behind the retina, which, although not directly impacting vision, could influence the recommendation of specialty lenses like multifocal lenses if it becomes extensive. All these tests play a crucial role in assisting your provider in choosing the most appropriate type and brand of lens for your cataract surgery. During the examination, your provider will not only measure the cataracts and plan the potential surgery but also assess other factors, such as dry eye. Treating severe dry eye before surgery is essential since it can significantly affect subsequent measurements, including lens calculations. Additionally, an integral part of this appointment is meeting your surgeon, ensuring a good rapport, and discussing the available surgical procedures and lens options. Your insurance provider will cover a basic cataract surgery procedure, where all the steps are performed manually by hand. The lens used in this surgery is a standard lens that provides consistent power throughout, without correcting astigmatism or focusing light at different parts of the eye. It generally results in good vision. However, your provider may recommend premium options based on your refractive goals and the specific characteristics of your eye. You can find more detailed information about different lenses in the videos I've created. Some common premium lenses that I offer to my patients include toric lenses, which correct astigmatism, and presbyopia-correcting lenses that provide a range of vision and reduce the need for reading glasses. It is essential to refer to the previous testing conducted during your clinic visits to determine if you are a suitable candidate for these types of lenses. When discussing cataract surgery with my patients, I cover various aspects, such as logistical details, risks associated with the procedure including possible complications and infections, and potential side effects. Your provider will have obtained additional measurements to ensure the selection of the appropriate lens type and power for your specific needs. If your provider has recommended treatments for dry eye, whether medicated or over the counter, it is important to follow their instructions diligently. While some providers offer dropless cataract surgery, where pre- and post-surgery drops are not required, most providers in the U.S. still utilize medicated drops. In many cases, these medications are started 1 to 3 days before the surgery. Make sure to obtain the prescribed drops in advance and familiarize yourself with the pre- and post-surgery regimen. On the day of surgery, ensure that you adhere to all the instructions provided by your provider, particularly regarding fasting. At our surgery center, we advise patients not to eat for 6 to 8 hours before the scheduled surgery. However, consuming water or black coffee without cream or sugar is acceptable. If you have any questions about dietary restrictions or timing, don't hesitate to contact your provider's office for clarification. The day of surgery can be a bit nerve-wracking, and each clinic, hospital, or surgery center may have slight variations in their protocols. At our surgery center, patients arrive an hour before their scheduled surgery to complete paperwork. Our nurses take you to a designated area where they gather your medical history, perform intake procedures, and administer dilating drops. By the time you enter the surgery room, we aim to have your eyes thoroughly dilated. An anesthesia provider, either an anesthesiologist or a certified registered nurse anesthetist (CRNA), will ensure your comfort and relaxation during the surgery. Some providers may administer injections around the eye to completely numb it, while others primarily use numbing drops and topical medications within the eye to keep you comfortable. The surgery itself typically lasts between 5 to 10 minutes, and patients are under conscious sedation, meaning they are awake but often not highly aware. The level of sedation may be adjusted based on your response to the medication. After the surgery, it is important to have someone accompany you since you may feel a bit lightheaded, dizzy, or tired due to the anesthesia. Being under any form of anesthesia increases the risk of falling, so driving home alone is not safe. Your provider will likely place an eye shield or patch over the operated eye. I recommend keeping the shield on for the rest of the day to prevent accidental rubbing or bumping of the eye. You can remove the shield when instructed to administer the prescribed eye drops. During the night, it is advisable to wear the eye shield for at least 1 week to protect the eye from unintended contact. For a few days after the surgery, it is normal to experience mild headaches, a sensation of having a foreign body in the eye, and some irritation. It is also common to have a bloody appearance in the eye during the initial days. However, if you experience sudden vision loss, severe pain, or intense headaches, it is crucial to contact your provider immediately. These symptoms may indicate high eye pressure, infections, retinal detachments, or severe inflammatory reactions that require prompt attention. Most surgeons have on-call providers available even during the night, so don't hesitate to reach out if you have any concerns. Congratulations on reaching the postoperative Day 1 appointment. During this visit, your provider will remove the patch or shield and examine your vision, eye pressure, and incision wounds to ensure everything is healing properly. It is normal if your vision is not perfect during this appointment, as it takes a few days for the eye to fully heal. Some individuals may take up to 1 to 3 weeks to completely recover their vision, as healing times can vary. This appointment is an excellent opportunity to receive any last-minute instructions regarding drops and restrictions. Feel free to ask any remaining questions you may have about the postoperative period. A few weeks after the surgery, you will likely be able to obtain prescription glasses if needed. From there, you can enjoy your improved vision. Thank you for watching and engaging with the content on eye health, diseases, and surgery. If you enjoyed this type of content, please consider liking and subscribing to my channel. I appreciate your support. If you have any further questions, feel free to reach out.